Welcome to Cancer Matters, where we discuss development, advancement, and treatment in cancer care. I'm Poovenraj Kanagaraj, and I'll be your host today. Early detection is key when it comes to fighting cancer, and today we are going to explore why it's such a crucial step. The impact of early detection is undeniable. Studies have shown cancer caught in earlier stages have significantly higher survival rates. Joining me today is Dr. Ankush Kalra, Medical Manager of Gene Solutions, and Mr. Raja Iswara, Commercial Director of Gene Solutions. They'll not only share the importance of early detection and what it takes to improve access, but also about their latest offering that could change the way we detect early. Welcome, Dr. Ankush, and welcome, Mr. Raja. Let's kick off before we go into in depth what you have to offer. And I just want to explore early detection in the landscape, right? So, Dr. Ankush, why is early detection so crucial, especially in the healthcare landscape today, and when it comes to cancer?
Correct. Yeah, I think I love that question because you know that cancer incidence has been rising across world and more so in Malaysia was website. According to the National Malaysia Cancer Registry 2017 to 2021 report, we have seen that the incidence is rising and that most of the cancer cases are detected in the peak stage, that's stage 3 and stage 4. Now it's a burden not just for the patients, but also for our government, right? From the patient side, definitely if they are detected late, the treatment options are limited. The quality of life is not so good. The survival is poor. There's increased mortality, there's increased morbidity. While from the government's perspective, of course, it has to invest more in the well-being of such patients. Now, if these patients are detected early, then the survival can be better. And not just the survival, the quality of life of the patients, the amount of money that is spent in the care of these patients can be reduced. So the burden both to the government and to the patients can be reduced. So that's why the importance of early cancer detection cannot be underestimated.
So, having been in this space for quite some time, do you think that there's still a lack of education and awareness on the importance of early detection, especially when, it concerns the top 10 most common cancers?
No, you see, frankly, I think cancer, it's a multifaceted problem, right? It's not accepted well socially also. I've had relatives, who were diagnosed with cancer, but they never shared their diagnosis. So it's not something that, people are open to talk about. It's considered a death sentence in our community. Okay? So I need to overcome all these challenges. Early cancer detection definitely needs to pay for. And the awareness, definitely, all these statistics that I told you just now point towards that how, the awareness is not at the optimum level. And something needs to be done there because this needs to come from the patients. They need to be made aware how important is early cancer detection because ultimately this is for the well-being of the patient.
I see. So, speaking of early detection, obviously there's, when it comes to detecting diseases like breast cancer, for example, or even prostate cancer, we often put in an age mark that, over 40, then you go in for a checkup, right? But do you think at this stage, even taking into account our lifestyle, what we eat today, and obviously there's a rise of NCDs coming from across of different factors. Do you think the younger group demographics need to actually also go and have early detection in clinics and hospitals?
Yes. So definitely, the simple answer is definitely yes. Age is a risk factor for cancer, right? So with increasing age, the risk of cancer increases. But then age is not the only risk factor. Besides age also, yes, like you mentioned, the lifestyle, how it has evolved, over years, definitely we have a lot of other risk factors that may contribute to cancer development. And besides that, we also know of some known risk factors, like your genetic history. Like say, if you have a relative or first degree relative in a family who had cancer, there can be increased risk to you also. So in all these cases, I think although we have been saying that, we need to test cancers for, let's say, 40 years or 50 years and above, but I think we see that this age is no longer so relevant now. And again, more and more studies are actually revealing that they are revealing about lung cancer. That lung cancer is now actually seen more in females, non-smokers, and this also tends to be more aggressive. So all these findings really tell us that, those typical risk factors that we have been looking at, we cannot restrict ourselves, especially when it comes to early cancer detection, because we want to detect every case of cancer early.
All right. Now, I do want to go into what gene solutions have to offer, but I also do want to inquire more about, when it comes to general knowledge, we obviously, there's the very common pathway. There's already a set pathway for certain cancers, right? You do your mammogram, do your IF or BT for colorectal and all that. What gene solution is trying to offer, especially spot masks, where does it come in today? In today's age where the everyday public might ask, why do I need to go for your test when there is a certain pathway already set, right? Would you be able to elaborate more on that?
Yes, definitely. Yes, I agree with you. The screening methods have been set for certain types of cancer. Mammogram for breast cancer, colonoscopy for colon cancer are all very well-established screening methods, right? And I think even in Malaysia, we do have the screening programs for his particular cancers. But when it comes to the early detection, the screening of population, do we want to screen for only one cancer? Or do we want to screen for a variety of cancers? There are two ways of looking at it, right? So if you want to screen for cancers, you only want to look at a variety of cancers. And that is something as simple as a blood draw. We all go for our routine annual health checkups, right? We are all very aware that once you're beyond 30, 35, or, even earlier, I think now people are going for their annual or biannual health checkups, which requires blood draw, right? So everyone is aware of that. But for cancer detection, you're not doing that. So probably, again, coming back to my earlier point, that cancer is still considered a social stigma in that way, and people are not ready to openly talk about it. The comfort is still there. So, yes, so as something that is as simple as blood draw, I think it will be very convenient to the patients. And then, screening for 10 cancers, that's with just one blood draw. I think it's quite efficient. It's non-invasive. So yes, it definitely has a role to play. And again, in coming to those patients who are at risk for developing certain cancers, I think there's role of the single cancer detection test as well. That is again done via the single platform.
I see. For the person who comes in and, like you mentioned, rich family history, right? There's always a question, if my parents do not have cancer, but perhaps my grandfather did, do I still need to come in? Would it be better, more precautious, to come in and do this test? Can I apply myself if I'm 30 as well, to come and do a spot mask, for example? Will that work for these group of people as well?
Yes, definitely. So right now we do see that any patient and any people who are more than 40 years of age can go for early cancer screening via the spot mask test. And then those under 40 years of age, but they have certain risk factors like you mentioned, the family history. Then they get also undergo spot mask test.
I see. Well, obviously at NCSM we already started, providing the spot mask services to patients who need it, right? And this is where I think I'm going to jump into Mr. Raja. You have done an MOU with NCSM in 2024. Would you be able to give us a bit of a background about how it all started? Why did you decide to work with NCSM? Are you also working with other healthcare experts to kind of expand the coverage that people can access to spot masks?
Sure. So basically, back in the year 2024 in June, both of our parties, National Cancer Society Malaysia, together with Gene Solution, we sat down together pretty much to talk about the nagging questions is how do we combat cancer more efficiently? And the simple solution towards this is potentially the solution can lie in the space of can we shift the needle of cancer detection to its earlier stages. So that is where we came up with this MOU signing ceremony last year, whereby the whole objective for this would be to raise the awareness first, because before we can even extend our solution, the first thing that needs to be done would be to raise the awareness, whereby we get the public to understand first what is the importance of coming in for their early cancer screening.
I see. In terms of expanding it and making it a bit more accessible, right? We mentioned that even Dr. Ankush had mentioned it. Are you finding it a bit more challenging to make it a bit more accessible to everyone? And are there programs that is available from Gene Solution side, for example, that anyone who's in need of it could have access to it?
Sure. The key point over here would be equitable access. I guess that word has been throwing around a lot these days. So what does equitable access pretty much means is whereby to enhance these particular solutions or even this whatever that we're doing more closer to the general public, to as many people as possible. So National Cancer Society Malaysia, NCSM, has done a great job in terms of reaching out towards the undeserved populations as well as the outreach communities where we by ourselves will find it a bit difficult to access to. And since NCSM has a great access and a very established pathway and platform together with these communities, what we're doing is simply leverage both our party strengths and come up with this synergistic collaboration in order to extend our solutions to this public and also these communities.
I mean, when we look at these partnerships, obviously it's a great start, right? But ultimately, what do you hope to achieve as well? We can speak about early detection, we can speak about undeserved communities, but what do you hope to achieve through this partnership as well?
One main thing what we hope to achieve is so that most people at risk population can come in and do their early cancer screening as soon as possible, especially if they fit the criteria like what Dr. Ankush mentioned just now, patients above the age of 40 years old and so on and so forth. They come in to their nearest NCSM clinics, request for a spot mass test or even other complementary tests that comes in together with the blood test, so that to have an informed treatment decision for the patient itself.
Are you foreseeing any challenges in terms of getting this test out to people? I mean, I suppose with Malaysians, healthcare has always been something that, they sort of analyze the offerings that we have. They're always asking doctors what are the benefits, right? And if it fits the bill for them and they have never been shy of technology. But I suppose there will be some form of challenges, especially when you want to reach out to undeserved communities or underserved communities, right? How do you, are you foreseeing any challenges? How do you plan to also tackle these challenges?
Sure. If I can summarize the challenges into 3 simple buckets, it'll be lying in the realms of awareness, access, and also the cost. So the first was awareness. That's what we spoke about just now, whereby we are trying to get the word out as much as possible, highlighting the whole need of coming in for early cancer screening and also the detecting of cancer on the early stages. Secondly would be towards the access component. How do we actually reach out to the public, especially for communities that we have otherwise will have limited access towards the most efficient treatment or even the most efficient diagnostic modalities available towards them. So that's where our collaboration together with NCSM comes in as well. And at the same time, it ties in very closely with the third bucket as well, which is the cost component. So that is where we come up in a very collaborative and very cost-efficient solution to the public so that we can ultimately achieve the goal of achieving equitable access.
So when we are talking about access to certain parts, and obviously, do you foresee different challenges coming from different communities that may live in Klang Valley, for example, who, private hospitals and government hospitals are actually all over around us, right? And so access to the healthcare and education, it may be tougher at some point, but we are also well equipped enough to be able to just reach out to a doctor. But if let's say you were to go to, perhaps Perlis or Kedah or Terengganu, where we may not have the same level of access to healthcare like we do in Klang Valley, do you think there's going to be a completely different set of challenges there?
Yeah, we definitely do recognize the unique set of challenges, especially for populations and even the communities that is situated in these kind of regions. So one of our solutions for this would be to leverage on the extensive platform that NCSM has provided, whereby the outreach community programs that is currently being done towards them, and they have the access towards the awareness programs that they are doing, as well as the platforms where they can come in and do these tests.
I see. Thank you, Raja. But Dr. Ankush, I do want to ask, right, with Malaysians and having been in the space for quite some time, they'll always have a question, is it really, does it really work? Or there'll be myth. In no matter which healthcare industry you go to, there's always myth and people are always doubting. It was the same case with vaccines and all, right? There's always questions. And has a doctor yourself, there's sort of this responsibility to be able to explain, right? Have you faced any sort of myth that people come and ask you, does it really work? Or, it's technology, have you been in that position where people may have some doubt, and how do you resolve those doubts as well?
Yeah, okay. So that's a very interesting question, Prash. I think, yes, especially when the technology is new, rapid, All this why we have been detecting cancers, but these have been either with the normal screening methods, or once the patient develops symptoms, then they come to the clinic. Now we are talking more about the proactive approach to it, right, where the patient comes and says that, okay, well, I want to get screened for cancer, and then of course they want to understand so that what are you doing, how are you going to do it. And because cancer is such a complex disease, from the patient side, actually, if you imagine, it's almost unbelievable for them to recognize that, oh, so you can screen for cancer via simple blood the draw. So sometimes, the simplicity also becomes in question in that sense. So I think in that sense, again, like you both were discussing just now, that the patient's awareness, the knowledge may also vary, right? So I think the approach would be very different. Let's say, we get a patient from Clan Bali, or somebody who is very conscious of health, has come to the clinic for the screening proactively. I think it would be very good to explain the basic what exactly are we doing. We are detecting the ctDNA blood, and then we are using the HGS technology. But again, to explain the ctDNA and the HGS technology is also a big task. But I think, as time passes also, because we started here in 2024, and we see that as time is passing, the uptake of early cancer screening is increasing. We are getting more queries from the patients, from the HCPs. So there is definitely a better understanding through all the efforts that we have done, that we've got together with NCSM from the year last year, and we still continuing to. So all this, I think, is bringing that awareness and that faith in the test, that okay, this is something that can help me in the long run, and this is something that I shouldn't be getting screened.
Yeah, Doctor, obviously we have been talking about how public would react to this advancement in technology, right? But I'm also very curious because as a Malaysian and as someone who has worked with the Malaysian public in healthcare, they would often say, I'll wait till what my doctor says. So I'll bring the test to my doctor and then see what he says, right? So there's a lot of trust in the Malaysian public in their doctors, right? How are actually doctors reacting to this technology? And with spot masks, are they accepting it, or are they saying that yes, this could really change the way that we could do early detection? You must be speaking to a lot of doctors everywhere, and especially you are spot mask is been distributed in 7 countries already, including Malaysia, right? Hong Kong, Vietnam, Thailand, Philippines, Singapore, and Indonesia. How are doctors reacting, not just in Malaysia, perhaps if you could share how they're reacting, even region-wise, how are they reacting to spot masks?
Yeah, sure. So, actually, we started our functions in Malaysia last year, but we have been present in other countries for longer time. So, of course, their journey has been longer, and then the acceptance over time has also increased. Of course, I haven't talked to the doctors there. I have all these insights from my colleagues. But something I could share from the Malaysian perspective is that when we go and we talk to the doctors among the spot mask test, the early cancer screening, there is a lot of excitement. There's a lot of excitement to understand that what are we doing. There's a lot of excitement to understand that, how will it contribute. There's a lot of, brainstorming that happens with the doctors and us, that, like it can really contribute, right now to the existing screening landscape that we have. So we haven't faced any resistance from the doctor side, because I think they do recognize the importance of early cancer detection, and that this is something that it acts as a tool for them. So to give to the patients, so that the patients can go for POP testing for cancer.
Doctor, I was in a situation where I had a friend who has been doing her health screenings since November, December, and obviously, there was a level of stress that she was facing at work, and obviously she then went to a doctor again, and they said she had stage 1 breast cancer, which then grew into stage 4. But we talk about having to do your health screenings when you turn 30, right? I've not done mine, I've just turned 30 as well. But of course there's that fear of like, you need to do once in a year. But with people who have been doing it once in a year, and then within the span of 2 months, they may say, okay, I've been having some symptoms, but my last health screen didn't get to it, right? How often can they come to a clinic and just do a spot mask check, for example, right? Especially when you have a rich family history, I think that's quite something that people are very concerned about these days. How often should they come into a clinic and do a spot mass test?
So right now, yes, if you have a family history, then it is recommended to undergo the spot mass testing, and the frequency actually depends on your result. So let's say if the result is negative, then this person should go for manual screening. But sometimes we also have the intermediate results, then we recommend to go for next test within the text.
Within the next 6 months. Okay. Thank you, Doctor. Raja, I want to explore more on partnerships, and obviously to educate the public and to get access, partnerships play a very important role. You have obviously worked together with NCSM, and I'm seeing it as I work there as well. Patients are benefiting from this test as well. How important are joint efforts? And I'm not just talking about gene solutions with NCSM. I'm sure you're already exploring partnerships with other people. How important are these joint efforts when it comes to educating the public, right? It can't just be a role that the government is taking on to educate, like early detection is important. How important are roles that private entities like ours play when it comes to educating the public?
Well, Raj, I'm pretty sure you heard of the old adage on it takes a village to raise a child. So it's pretty much similar in this situation as well, whereby the partnerships that we're doing, actually it accounts to a lot more when it comes towards the outcomes that we do see. So first things first, the efforts that Gene Solutions do put in for the public when it comes towards early cancer screening and whatnot, it can be enhanced further by simply partnering with other private societies or even non-governmental organizations. To a certain extent, even the government stakeholders, insurance companies, and all the private medical doctors and all the doctors as well. So we do see a huge role of coming in together, holding hands together in order to combat this so that we can raise the awareness, build up the education, and get the word of mouth out there as much as possible.
Mm-hmm. I see. And where do you see the future of our collaboration going further in the year to come, in the years? Because obviously cancer does not discriminate. That's for sure. We can say you could earn this much, and cancer is cancer, right? But where do you see this going? Do you have a target? Do you have an aim? You have a kind of a number to put to it. Where do you see this collaboration going for?
All right, before I talk about the future, probably I can talk a bit about the past. So many years ago, back when tumor markers, cancer markers was first introduced towards the whole ecosystem, there was a lot of reluctance towards it. There was a lot of pushback towards it. The whole sentiment was, wow, how can you detect cancer? How can you catch cancer just simply by doing a blood test? So what we are doing right now is we are simply enhancing and accelerating the whole technology component, making it as innovative as possible towards this. So probably if you ask me, where do we see this whole partnership going, is whereby I guess we do hope together that one day we can see that early cancer screening by an innovative tool like a ctDNA technology can become a routine standard of care, whereby as long as they fit the criteria above 30 years old, above 40 years old, and this can be the first line cancer screening method prior to going for the imaging test and all the other tests necessary towards this.
I see. Now, just before we wrap up, right, what message do you want to share to Malaysians about the importance of early cancer detection, and perhaps just in your own words, the role of spot masks can play in their own life and for their loved ones as well?
Sure. So if I can keep my message quite short and simple, I guess don't wait. I think it's very, very important to detect cancer earlier. Quoting back Dr. Ankush, what she mentioned just now, take for example lung cancer. Majority of the cases are being diagnosed at stage 3, stage 4, about 90%. And if we can actually diagnose this and catch this at an earlier setting, stage 1, stage 2, the whole outcome will be much better. So the faster you act, the better outcomes that we can do foresee for the patients.
And Dr. Ankush, what about yourself? What do you want to tell to the Malaysians today about early detection and potentially the benefits that spot masks can bring to them?
I think from my side, I will just request everyone to please take charge of your health, because most of us are doing health screenings, but do consider cancer screening as well when you're undergoing health screening, because it's your health and we have a goal.
I see. Thank you so much. Prevention starts with an action. So if it's been a while since your last screening, consider booking one today. It could save your life and the life of someone you love. Thank you to Dr. Ankush and to Mr. Raja for joining us today. I'm sure there's plenty more to chat, but here we are, and I hope this helps to everyone as well. Thank you so much.
Thank you, Raj.
Thank you.